Today's topic is CURB-65 score. The CURB-65 score is used to assess the severity of illness in community-acquired pneumonia. It is used to decide whether to manage the patient with IV antibiotics or not. The lower the score means the lower the mortality rate, and the higher the score means the higher the mortality rate. The higher the score is, consequently, we manage a patient with IV antibiotics in an inpatient management, ICU management, so that the patient improves. There are other criteria and parameters which are used to assess the severity of community-acquired pneumonia apart from CURB-65, but this remains a very commonly used one. The criteria, the CURB-65 has 5 criteria. Each is given a score of 1, and the max score consequently is 5. And it is easy to remember by the same mnemonic CURB-65. So C stands for confusion, which can be measured by an altered mental state status exam, or just subjectively looking at the patient and seeing if he is disoriented in time, space, or person. U stands for uremia, BUN levels greater than 20 milligram per deciliter or greater than 7 millimoles per liter. R stands for respiratory rate greater than or equal to 30 breaths per minute. B stands for bradycardia. Now bradycardia here will get a score of 1 if the systolic blood pressure is less than 90, or even if like the systolic is normal but diastolic is less than or equal to 60 millimeter of mercury, then there will be a score of 1 given for this. 65 stands for age. If the patient is 65 or more years of age, then he will get a score of 1. So combine the max score of 5. If there is no criteria fulfilled by the candidate, then there will be a score of 0, which is the minimum score. So if there is a score 0 or 1, we manage the patient in the outdoor, give him oral antibiotics and send him home. If the score is 2, we manage the patient inpatient on the general floor. We can also give him IV antibiotics and do some monitoring as well. If the score is 3 or more, that is very severe case of community-acquired pneumonia, and the mortality rate can go above 22% as well. So in that case, we manage it in the ICU with constant monitoring and IV antibiotics until the patient improves. And that is all from today.